Good morning. Just be a moment before we get started. Good morning, everyone. I'm Sunnyvale Mayor Larry Klein. Happy December. It's going to be a holiday season unlike any we've ever seen. But welcome. This is the 38th installment of my weekly virtual office hour address. People say they appreciate these weekly live stream addresses and hearing from the mayor, so I'll continue to do them through the end of shelter in place and a little bit longer. This Facebook live stream event is great, because it allows me to give you some updates, answer some of your questions, and of course provide some words of encouragement. Thank you for allowing me to continue to represent you and work for Sunnyvale during these ever-changing times. So I hope everyone is doing well, staying healthy. Please remember, take care of yourself, both physically and mentally. These are difficult times for so many of us. Keep following the county health orders, the state health orders. People need to do their part to stop the spread of the virus. Continue to wash your hands. Don't touch your face. Reduce the number of people that you come in contact with on a daily basis, and of course, maintain safe social distance and wear your mask. It's mandatory. It is critical. It helps. There's been lots of studies that are coming out recently on how a mask does make a difference. So please do so whenever you're out. And if you need a face covering, please contact me. And of course, the latest is get your flu shot. There's multiple places around the county. The county's providing free flu shots, as well as all the healthcare providers, the drugstores, all the pharmacies are also providing them. So definitely do what you can. We've had a surge in cases and continue to have a surge. So you could be a carrier of the virus. Someone that you meet could be a carrier and not showing any symptoms. Be asymptomatic. So doing what you can to prevent that spread is really, really important. So we're now 263 days after the March 16th county health order started the shelter in place in an attempt to slow the spread of the virus. And since that declaration, a lot has happened. A lot more happens almost every day, especially this week. I've had daily press conferences to watch, seminars to attend, conference calls to confer, to advocate on your behalf. And this week we've seen lots of changes. Last week was pretty quiet. So let's talk a little bit about what happened at the federal, state, county, and city level over the last week or so. Uh, last week was Thanksgiving week. Things were a little bit calmer, and I hope everyone had a good Thanksgiving weekend. Last Saturday was Small Business Saturday, so remember to shop local, support those local businesses. And it also, when you're doing that, it also provides necessary sales tax revenue to the city. So it really is important, and so, visit your local retailers, visit your local restaurants, and, buy gift cards for like restaurants is a good way. But whatever you can do, support, the small family businesses. It's really difficult right now for them, and might be getting a little bit more difficult in the coming weeks. So on Monday of this week, Governor Newsom and Dr. Galley had a press conference, and so Governor Newsom had been quiet for almost 2 weeks, mainly so sheltering in place because his children have been exposed to COVID-19 from one of the CHP officers, and so um, Governor Newsom warned about, a more dramatic COVID-19 stay-at-home health order would be coming later in the week. And true to form, it did happen yesterday. So I'll be getting to that a little bit later. But a lot of Monday's discussion was talking about the increasing number of cases, and the other thing is the reduced availability of ICU beds around the state. And so that was a big thing that he was talking about, the number of deaths, the number of COVID cases. They just continue to increase. And so that was a large portion of the discussion, from a governor's standpoint. And then from a business standpoint, there were multiple things that he talked about. Tax deferrals for the small businesses. He also talked about up to $25,000 grants for small businesses, and so I think there's 180 million, and if I remember, money being set aside from a state level for small businesses and also nonprofit and cultural institutions. So the governor recognized, much like the city did, that it's not just about small businesses. It's about some of these service organizations. It's some of these other nonprofits that have been in our city for years, in our state for years, that haven't been able to do appropriate fundraising during this critical time. And so I think, to me, that is important. Whatever we can do. It's he talked more about the number of counties in the purple tier, and it's almost a completely purple tier state at this point. There's a few red counties throughout, spread in different locations throughout the state, but almost the entire state now is in that most restrictive tier. That being said, the cases continue to go up, and conceivably one of the things that was brought up is, for people that were meeting during Thanksgiving weekend, we still haven't seen the effects of those people and any spread of the virus that happened during Thanksgiving. So it was a little sobering, and hopefully people are taking this very seriously, as far as being safe and trying to spread trying to slow the spread of the virus as much as possible. A few weeks ago we closed indoor restaurants. It was about 2 weeks ago now. For any of the counties in the purple tier, they closed indoor activities associated with gyms and museums and zoos, but places of worship, movie theaters, and so this is, even with those restrictions, we continue to see an increase in the number of cases. So, and we'll talk a little bit about what the latest announcement yesterday means to our county, our region, and the state, which I think is critical. It is the light at the end of the tunnel. The vaccines are being released. we are starting to get some idea of how many um, vaccines we'll be getting from a state standpoint, and we're starting to plan doing those plans. So we're within a month of getting vaccines and starting to distribute those within the state. And so to see such a critical or such a large number of new cases during this time when we're at that end of the tunnel point is difficult. So anyway, let's go on to other things that are happening. On Monday evening, the city had its first of the Moffett Park outreach meetings. And so this was the first of 3 virtual community workshops to talk about what's the future of the Moffett Park. So it's the Moffett Park specific plan. And if you want to find some general information, you can go to moffettparksp.com. That's MOFFETT parksp.com. And so the first meeting, this is the first of 3, was all around sea level rise and urban ecology. And so, and we changed the kind of how the meeting was set up. So the first 2 hours, so 4 to 6, was all about staff presentation on things that they've learned, kind of giving an update from a Moffett Park area plan and kind of looking at sea level rise, what issues to look at, what are some of the mitigation measures that the federal government is looking at from a regional standpoint, what we can do, and what are some of our partners from, like working with the Valley Water District, who already has plans to change the east and west channels that exist in Moffett Park to make them, to basically to deal with high tides, as well as king tides, as well as conceivably the rainy season, and if there was basically a combination of the two, how to make to prevent flooding in that area. And so that was one of the big things. So we had about an hour or almost an hour presentation, and then an hour for residents to give feedback on other issues that they would do. We also used something that we hadn't done before, was use Mentimeter.com, which allowed residents to put their questions in. So it was good because we could do online polling, as far as what people's priorities were for different mitigation measures and other feedback. Also, it was good that people could ask questions and uptick questions. So if multiple people had the same question, from a priority standpoint, that could be, people could uptick and say, yeah, that's my question too, I'd like to hear it. So it was good from that standpoint. So it was 2 hours of presentation and answering questions from the residents, and then it was getting resident feedback. And then finally, there was a study session. So for about an hour, the city council was able to give feedback to the residents or to the city staff on things that they'd like to see on future presentations, other direction, and kind of priorities that they see from a council standpoint. So I think it was a good first attempt for trying something new as far as these outreach meetings were concerned. We've done a lot of Zoom outreach meetings in the past 9 months, and so this was, I think, one of the good things as far as taking a look at how to better get feedback from residents. So I do think it worked out well from that standpoint. So that was the first of 3 meetings. The second meeting is, as I talked about previously, is a transportation and infrastructure meeting, and that was supposed to happen on December 10th. But with the end of the year and a lot happening, the staff working with the consultant decided to move that to February 1st, and then so that'll be from 4 to 7 p.m. on February 1st, and then the last meeting will be land use, housing, and open space. That hasn't been scheduled yet, but if you go to moffettparksp.com, you can get up to date. You can see the presentation, and if you happen to miss the meeting, there's also links to the video that if you want to go back and see the video on the presentation, the question answering, as well as direction from council, you can take a look at that there. So that was Monday. Tuesday, of course, was Giving Tuesday. So, Monday was Cyber Monday, when, although I think, the whole weekend was Cyber Weekend for a lot of people. But Tuesday was Giving Tuesday, and hopefully, if you had a chance to donate, please, I hope you donated to your favorite nonprofit. You know, please support our local, nonprofits. They really need your help. They weren't able to do the normal fundraising this year, so you can go take a look at my post from Tuesday if you want, for some of my favorite nonprofits that are here in Sunnyvale. But there's whatever you can do, it's really good. They've been doing a great job, especially some of our service nonprofits like Sunnyvale Community Services and Our Daily Bread, during COVID, providing some really critical services. So but there's lots of good nonprofit organizations that people volunteer at, that do good within our community, and so take a look at that, if you get a chance. And then Tuesday evening, council met, and so this was our planned second to last meeting of the year, although we might actually have an extra meeting before the end of the year, the way things are looking. And there were several things on the agenda. First, we started off with a special order of the day for the public safety special awards, and this is something we do every year. We basically bring in all of the officers, and certain residents that have gone above and beyond the call of duty, and made a big difference within the city. And this year was actually different, but I think it was better in some ways. So we had a video, and it was useful because we actually heard some of the dispatcher calls. We got interviews with some of the residents, and heard from some of the public safety officers, getting a better description, not just a quick description, but getting a little more personal atmosphere of what they went through, or why they should receive the award. So it was really great to hear the stories, and I want to thank all the awardees. If you haven't had a chance to watch the video, it is really good. It's only I can't remember now, about 10 minutes, 15 minutes, but it really gives a good perspective of what happens within a city every year, and some of the great things that our public safety was able to do over the last year. We had several other things on the agenda, from let's see, from going through, hang on, lost track of where I am. So other things on the agenda, we basically heard how to deal with CDBG money, so our basically community development block grants that are federal funds that we end up distributing every year. And so we spent a good portion of the meeting talking about how those funds will be distributed. And this is how this is why the census was so important, because a lot of the federal funding is then based upon headcount within the city. And so these were federal funds that we basically reaffirmed based upon our Housing and Human Services evaluation. We basically take federal funds, we put in additional funds every year to deal with some of the service organizations that are working within our city, not exclusively ones that exist within the city, but some of the ones that come in and deal with mental health and services for seniors, and a lot of those different organizations that do that work within our city and provide additional services. So that was one of the big things that we did from a council meeting standpoint. And then midweek, at a federal level, and it's been more than 8 months since the last major COVID-19 relief package. The CARES Act was signed by the president, and since then it's been this long stalemate within the Congress to follow up on what the next package would be. And had done a lot of lobbying throughout the summer on trying to hope that there's bipartisan agreement to provide more funding for the cities, because the first CARES Act was mainly at a state level and counties over a certain number, and then city or all counties, and then cities over a certain threshold of 500,000, and so from our standpoint, it was or 250,000 cities over 250,000, and so it was something that we were able to get some funds from the state, but it would have been better to get those funds, those CARE Act funds, directly from the federal government. And there's a lot of small cities that couldn't apply, and so hopefully there's been work this week between the Republican Democratic lawmakers to hopefully go across party lines and finally do something and breach that impasse that's been there for a while. We'll see whether or not this makes any progress in the next week. There's been a certain commitment from certain legislatures that it will get done, but I still the proof is in the pudding to a certain degree. It's like I've been hearing that for months now, and definitely it's not been moving quickly, and so I'm not expecting things to magically fix. I'm keeping my fingers crossed, because we could definitely use the assistance from a city standpoint. And then on Thursday, yesterday, Governor Newsom had another press conference, and as we talked about earlier, the state has seen the highest newly daily case count of the pandemic over the last week or so. And so the governor made good on the pledge that he made earlier this week. So he's pulling the emergency brake again, and this time he's announcing a regional stay-at-home order in California based upon a region's intensive care unit capacity. So this is different than the 4 tiers before. So right now, because the cases around the state have continued to increase, but more importantly, our hospitals, the number of ICU beds have continued to go down, and so in order to have in order to basically prevent COVID patients from using up the majority of the ICU beds, it became more and more important to look at not just what the case counts are, but how many, and that's been kind of the focus of the 4 tiers, but looking at ICU cases and how and what the capacities are from different regions, and as opposed to on a county by county basis. I think it was important that Governor Newsom looked at from a regional standpoint. So Northern California, Southern California, the San Joaquin Valley, the Bay Area, and the Greater Sacramento area. So those are the 5 regions that the new order is breaking the state up into. And Newsom already indicated that 4 of those 5 regions are already very, very close to that 15% ICU threshold. So when a region drops below 15% ICU threshold, it means that the new order comes into place, and we'll talk about that new order in a second. The 5th region, of course, is the Bay Area, and it's on track to reach that threshold sometime mid-December. But as far as the other 4 regions, the governor was pretty clear that it looks like that all of them will reach it within the next week. And I was surprised, so from our region standpoint, it looks like we have about 2 weeks, but from the rest of the state, it looks like it's going to be within a week. And so this will define a new stay-at-home order that when the order goes in place, so when a region goes under 15% threshold, they have, of course, 48 hours to make certain adjustments. And these restrictions are basically back to where we were at the beginning of shutdown, or very close to that. So retail will still be allowed, but it's now at a max of 20% capacity, as opposed to right now it's 25% capacity. But bars, wineries, personal service businesses, hair salons, barbershops are to be closed. So that that means, if you need to get a haircut, you have about a week and a half to do it. I would, if that's something that you're looking forward to, definitely, uh, do that, because it'll be, and who knows how long we will stay in that under 15% ICU percentage. But that is, a big restriction. Other parts of that stay-at-home health order will be, schools with waivers can stay open, along with critical infrastructure. And I haven't read through all of the new county health, or the new state health order, but that's what that critical infrastructure is. We'll figure out, and I'll give more information next week. But restaurants will then be limited to takeout and delivery service only. So, right now, all the restaurants have, had to close. Going into purple tier meant that they actually had to close all the indoor seating. This now means that they also will be closing outdoor seating. So if you're enjoying eating out at your favorite restaurant, being outside of your home, and sitting outside while we still have good weather, and it looks like it's going to continue to be a very dry November. So the rainy season really hasn't started yet, but definitely take a look, and enjoy that while you can, because things will be limited, and also that all non-essential travel would be suspended in those regions. So, and the CDC has already called for people to call off their holiday plans as much as possible. There's been a lot of work, I hear from people to either reschedule or get refunds for what they had initially planned. But I am looking at this and looking at the numbers, and we'll talk about the numbers in a little bit. But this is not an easy thing, and it looks like the majority of the state will go into lockdown very, very quickly. And we're fairly lucky from our county standpoint, and I think going to that regional standpoint from an ICU makes a lot of sense, because as opposed to one county, if one county's ICU beds were filling up, definitely patients would be transferred to the adjacent county. So when you're looking at kind of healthcare coverage and how we deal with patients, looking at it from a regional standpoint makes a lot more sense. It does mean a lot, and as we're looking at what those numbers are, and I've been really shocked about seeing some counties where they have like only one or two ICU beds still available. It's just a little shocking, to say the least. We had 18. So when part of the governor's overview was, he reported that from a state standpoint, we had 18,951 new cases on Wednesday. That's almost 19,000 cases, and that's the third time in the last 10 days that the state has breached the previously unimaginable 18,000 number. And so the 7-day average is currently about 15,000 cases a day. But we've had definitely a lot of spikes, and the 14-day average positivity test rate is about 7%. So, and that's up almost 2% from just last week. So, and as a state as a whole, we've had, and this was a little surprising, we've had of the ICU beds, we only have about 1,731 available out of 7,600. So we've used about 2/3 of the ICU beds available around the state, and so that part of the order, or part of the governor's update was that they have plans to open certain regional health areas that will be run by the state. So there's one in San Francisco, and pretty much every region has one or two state-run locations where they'll be setting up beds to deal with the overflow, and or the overflow of patients from a ICU standpoint and from a hospital standpoint. The good thing is we have done a lot of planning, up to this point. So stockpiling PPE, stockpiling, ventilators, all these things, have been going on throughout the time of the shelter in place. And so, from a state standpoint, we've done a lot of planning. We're ready to deal with those ever increasing numbers. We hoped it wouldn't get to this point, but definitely as we got into the fall season, the cases continue to go up, and there seems to be no end in sight at this point. As far as the number of cases, there were several press conferences this week from a county standpoint, and the county was talking about new cases at one of the local jails, one of the local youth centers, one of the shelters. So we've seen different portions of county-run facilities where they've also seen these. We actually haven't had any new cases. We haven't seen a surge at our homeless shelter in Sunnyvale. So that's been very positive. But around the county, around the state, we have seen lots of cases. So let's from that standpoint, we can go ahead and get to, actually, before we get to that, let's talk about what's upcoming, and then we'll get to what the cases are from a county standpoint. So what to announce some of the upcoming events. So on Tuesday evening, it's our last currently scheduled meeting of the year, and we have a very, very full agenda. So we will be approving the scope of work for the implementation of the Sunnyvale Mobile Home Park Memorandum of Understanding. And we talked about this previously. This was one of the things that we'd had the housing study that came back to us with multiple items, and one of those items was the concept of the council decided on either, it was a choice of an ordinance or a memorandum of understanding, and so council finally by a majority chose that they wanted a memorandum of understanding between all the landlords for all the mobile home communities. So this is kind of setting the time frame, the timeline for the implementation, for the outreach, to come to some agreement. And then if that MOU isn't moving forward quickly, and the good thing about an MOU is it can, as the landlords get together, they can start looking at parity between the different mobile home communities, and making sure that they're all kind of being run at a comparable sort of thing. And hopefully anyone that isn't doing that will decide to say, okay, I'll go with the majority and kind of roll things back. That's one of the things that if we put an ordinance in place, we couldn't cause any rollbacks, and so that would have to be done by an agreement of the landlords. And so hopefully that will go quickly, but that's one of the things that are on the agenda. We're also, and I talked about this previously, approving the preferred concept for the Lakewood Branch Library and Learning Center. And so this we talked about for a while. We did outreach in the summer. Actually we did several outreach meetings, one just before shelter in place, and then two virtual outreach meetings. And this is, the consultant working with staff have come up with a final design with all the resident input. And, from what I've seen of some initial plans, they look really good. Haven't went through the full construction documents as far as that's concerned, but it'll basically, finalize the design, and it's already went in front of the different school boards, the library, the the branch library and learning center. It's a partnership, and that's what's really great about it. It's a partnership between the city, the Sunnyvale School District, and has Lakewood Elementary right next to the library, and the Fremont Union High School District, which will have, basically help staff a learning center in at Lakewood. So to me, it's very much a win-win situation between those three entities to create the best design possible, whatever the needs are for the community there, and then providing long-term services, providing that learning center, much like Columbia, the Columbia Center that we have right now. And so, we'll be doing a final preferred concept and, doing the final bid proposal. So ultimately, I think it'll be really good from that standpoint, and to see that move forward, and hopefully construction will start sometime next year. So that to me is very positive. Other things, let's go ahead and get to the county, and other things that were supposed to come up. I might have mentioned, I think last week, that we were supposed to have the tree lighting in downtown tomorrow. So at for our annual tree lighting ceremony, and it was going to be a virtual event. We're still looking to see whether or not we'll do a quick virtual event, but it was supposed to bring in all the council members safely distance, of course, to do the tree lighting. Might even had a special visitor, but with the increase in COVID cases, that tree lighting ceremony was canceled. So, but the tree is downtown. You will be seeing it lit, I think, starting on Saturday. So if you get a chance to see that, definitely drop by. Okay, let's go ahead and get to the health dashboard on testing and hospitalizations from a state standpoint. From a national standpoint, we're now at almost 14 million cases. So just amazing to hear, that number, 13.8 or 9 at this point. But, we're almost over 14 million cases. And then from a California standpoint, we have done, we just passed about 1.25 million cases. So 1.25 million cases, and we're almost at 20. It's amazing. Almost at 20,000 deaths. So 19,400 and something deaths. And so, it's shocking, to see how many lives, how many families, how many friends have been affected by COVID-19. So please do what you can to stop that spread. Take this very seriously. Things are looking worse from a county standpoint too. New cases continue to go up. The number of total confirmed cases in the county is now at 36,637. That's up about 4,200 from last week alone. And so, that in itself is amazing when we were, in just hundreds a few weeks ago. So, it's 4,200 over the last week. It was 2,300 more the week before. Before that it was 1,600, 1,000, 800, 700. So just in the last 4 or 5 weeks, we've seen, 4 times as many on a week by week basis, 4 times as many new cases from a county standpoint. So, it is a little scary to see how much that's number has increased. And then, from a county standpoint, we've had 533 deaths. So, and that increased 60 in the last week, which is the most it's increased since we've started talking about week to week cases and the number of people that have died because of COVID-19. So it is, really scary. We have 296 hospitalizations right now. That's up 75 from last week. And so, that's compared, last week we only had, 221 cases. So it's in just the last few weeks, it's gone up, 70, 60 or 70 almost every week. And, that to me is showing why our ICUs are, our ICU capacity is filling up so rapidly. And then from a number standpoint, San Jose continues to have the most cases. They alone have had 24,070 cases. Um, that's up about 2,700 just from last week. And so, last week it was 1,750 cases. Before that, it was 1,550 cases. So, it's amazing to see how much their numbers have increased. And even from Sunnyvale, we have now had 1,587 cases. That's up 175 from last week. Last week it was 120 up. Before that, 100. So we're almost double from where we were a few weeks ago on what we're seeing on a week by week basis. So, please, do what you can to slow the spread. I continue to do a lot of advocating on your behalf. From a county level, I continue to have weekly discussions with our county supervisors. The county health mobile pop-up van is back, is in Murphy Park on the second and fourth Mondays from 9:30 a.m. to 4 p.m. And so they'll be back here on December 14th and December 28th. And you can go online at sccfreetest.org to get that, to sign up, RSVP for a specific spot, or you can go to some of the other cities around us that also have locations where you can actually get tested. So that, or your healthcare provider should be able to provide you a test. I got tested at Stanford just last week. Okay. Let's go on to some of the weekly questions. So Vanessa asked, and it's a long question, so it'll take a little bit. I've recently noticed what appears to be a homeless encampment in Lakewood Park, and I've never seen one there before. I have a couple of questions about this. First, is there anything that can be being done to help these individuals find safe shelter and resources? And then second, I'm concerned about safety implications of park goers and children, and as there's a large amount of trash as well as personal belongings involved. Is there a compassionate way to solve the safety issue while also addressing the needs of the homeless living in the park? I'd like to see a resolution that benefits all parties and treats the homeless as humans. And thanks, Vanessa. This is a very difficult time. COVID has been a very difficult time for so many, and we've seen an increase in our unhoused population throughout the region, throughout the state for that matter. And so, I know Sunnyvale Community Services and Downtown Streets team have been working to provide services to this encampment as well as several encampments throughout the city. And ultimately it's working with the county to find permanent housing. And part of the issue, of course, is, the shelters have actually reduced the number of people because of COVID-19 concerns. So, we were lucky, and this is one of the things that I've been working with the county on before COVID-19 started, to expand. We used to have 125 beds at our Ross shelter. And first it was a cold weather shelter, and then it moved to a year-round shelter, looking at trying to place people and families into permanent housing. And all the other thing is in that advocacy, working with the county to increase the number of people that could be housed there from 125 to 175. That being said, because of COVID-19 concerns, we've actually had to reduce the number of people that are there. And so, from that standpoint, it's been, very difficult, because conceivably people that need those beds haven't been housed. And I'm working with the county to see, and been doing advocating, and Sunnyvale Community Services has been advocating strongly to find permanent locations for as many people in our homeless community as possible. And that one of the things is, even though that's a Sunnyvale shelter, especially during COVID, it's been basically housed by anyone from the county. And so we were hoping that Sunnyvale, it used to be Sunnyvale had priority there. Sunnyvale unhoused had priority there, not so right now. So we're trying to get that focus on those services. And so from a safety standpoint, public safety definitely works with and has continued to work with Sunnyvale Community Services and Downtown Streets Team. And Downtown Streets Team is a pretty unique organization. So Sunnyvale Community Services is looking at providing services and food, housing, and getting them into transition to if they need county health services, making sure that they're getting that appropriate support. From Downtown Streets Team, they're looking at transitioning homeless into housing and full-time jobs and giving them a step up so that they get into kind of the operational thing and giving them a job. So it's like helping them clean El Camino Real, clean Murphy Avenue, clean around downtown the parking garages near the Caltrain station. So this is one of the positive things that organization is doing. And so between the two of them working closely with some of our unhoused population to provide them food, provide them health services, and hopefully the big thing is get them permanently placed or temporarily placed as needed. So one of the things that the project Home Key from a state standpoint provided a certain amount of funding to get the unhoused into hotels wherever they can. And so and that's one of the things that we're trying to get some of that county funding to support. So there's county funding from the state to do that project Home Key. And this is one of the things that we're looking at and doing appropriate advocating on our behalf is part of what's going on right now behind the scenes. So it's not difficult. All of our cities are dealing with this issue and the needs. And if you can look at donating to Sunnyvale Community Services, looking at donating to Downtown Streets Team, looking at donating to Our Daily Bread, which is providing free lunch Monday, Wednesday, and Friday to anyone who needs it. No questions asked. I on Thanksgiving week, I volunteered there, passing out food, and there's been a lot of one of the good things is a lot of the groceries have stepped up and provided a lot of the food to make sure that people who need food can get it. So individual salads and desserts and meals, burritos, whatever are being are available to those people that need it. And it was good to see the several hundred people that showed up to get that food in, and we've definitely seen those needs increase. So consider donating to some of our service organizations that really are making a difference right here in Sunnyvale if you haven't already. Okay. Several other questions I got. What's happening with the Macy's? So the Macy's, and you've seen a lot of work around the Macy's if you've been downtown recently. They're looking at some of the street changes in preparations for the demolition of the Macy's, which should be happening in the next month or so. And I'll give you that date when that happens. But that will be demolished sometime in the next month. And they're doing currently preparations for the building, for utilities, for water as they can. What's happening? We've had this question for the last 5 weeks or 4 weeks or so. What's happening with the counting of the votes? On Tuesday evening, the county registrar certified the election, so I will be your mayor for the next 4 years. So thanks for everyone who helped out my campaign. The county registrar was very clear that within that 30 days they would count all the votes as well as do a certain number of recounts for certain cities. There were several elections that were close, and so they had to do recounts for anything that was within a I think within 0.5% or something of that nature. But thanks to everyone who helped my campaign, and thanks for your encouragement and appreciation. That's almost been overwhelming. I look forward to working with you in the coming years, and whatever we can do. This year has been, let's say, different to say the least. But I'm looking forward to when we can meet together, when we can have events, and I can see you face to face, as opposed to these weekly virtual office hours. What is the ICU hospital bed capacity in Santa Clara County right now? I don't have those numbers off the top of my head. So from a capacity standpoint, and I did look at that number. But if you go to the county dashboard, and I'll have that for you next week, and I'll respond back to you in the chat after the meeting. But if you go to the county dashboard site, they give you what the numbers are and what the capacities are, and so that's one of the things that the county dashboard has been very good as far as breaking things down by zip code, by city. Looking at hospitalizations, looking at case counts, looking at death rates, all that, that's one of the things that in working with the county, they became very transparent, and I really have appreciated that as far as from that standpoint, making sure that everybody's on the same page around the county on what's happening at the county level, what's happening with our with COVID-19, because it's not just one city, it's not just the county itself. It's trying to figure out how we're working together. What's the availability? What's the next effort that we need to do. So it has been an extraordinary year, to say the least, and I'm looking forward to 2020 being over, and hopefully things are a lot better in 2021. So anyway, we're almost out of time, so let's go ahead and wrap up. I just want to thank everyone for joining me again this week. I know it's not easy. It's a lot has happened, and there is a general fatigue. As always, I'm proud of our Sunnyvale's response to the pandemic. I continue to hear stories of people helping out, friends and neighbors, and delivering food, or just raising money. One of the things that happened, even during the pandemic, last week, one of the Eagle Scouts, one of his projects was to raise funds for Officer Jackson, and that was one of our canine officers that lost his life in the line of duty on Halloween about 3 years ago. And so it was good to hear, and that that he's only a junior. So over the last year and a half, as his Eagle Scout project, he's raised funds. He created a plaque that'll be proudly displayed at our public safety office. But he also raised $6,000 for the canine program, for protective vest and gear for our canine officers. So I was really impressed, and so that was one of the things that happened, even during shelter in place, and came to fruition. So it's the donations of PPE equipment, it's neighbors helping neighbors, it's neighbors helping strangers, which is really good. So I know it continues to be difficult, and the governor went on quite a bit yesterday on people doing what you can to be safe, and also exercising for your own mental health. I think that's also important. It's like getting out, taking the dog for a walk, which is one of my things that I do every day, but doing yoga, getting outside of the house, going for a walk, going for a bike ride, trying to stay in a good mental state. It's not difficult, and I think that's one of the reasons why we're seeing such a big uptick in cases. People are just tired, and I understand that, but you know, to give in at this late state when we're finally seeing vaccines, being distributed. And there was a lot of work, a lot of discussions from a county level and a state level on preparation for those distributions and who will be, who will get the first distributions. And we'll talk about that, next week. But do your part. Wear your mask, be safe. Things are continuing to change. And get your flu shot, but help your neighbors. Share baked goods. Continue to build community wherever we can, especially during these difficult times. I'm proud to see Sunnyvale residents pulling together, and it's if you're out on a walk, wave, say hello from a safe social distance. People do miss that social interaction. Sunnyvale will emerge from this as a stronger community. We're in this together. We will get through this together. So thanks for listening. Until next week, stay safe, stay warm, and of course, wear your mask, get your flu shot. It's a difficult time for many. Take care. Until next week. Goodbye.